So thanks everyone for joining for our first webinar on rate and rhythm primarily, in which we'll talk a little bit about stability as well, because anything that deals with the heart is dealing with systemic issues, so we want to make sure that we're addressing that too. So the first thing I want to do is really just discuss for a second and give credit to some of the main sources of the information where this is all coming from. And so my main teachers, Dr. Leon Hammer and Jeffrey Ewan, and of course Dr. Hammer's information is to a large degree based off of his time and training with Dr. John Shen, and of course his refinement on much of his learning in the pulse system and a lot of the concepts that derive therefrom. So for today, what I want to do is discuss really the crucial aspects of rate and rhythm, and I think these are issues that aren't addressed much in Chinese medicine these days. We hear a lot about fast pulses with heat and so forth, but we don't really get a full exploration of the impact of rate and rhythm and what that has, not just on the heart, but also on systemic issues as a whole. So we're going to discuss a lot of the beginning information will come from the work with Dr. Hammer, and then we're going to discuss a little bit about some of the classical perspectives on rate and rhythm, which are really not so dissimilar, but I think they will provide a little bit of a richer context and sort of broaden our scope of understanding of these issues. And as we move along, what I want to do is move into, of course, some of the concepts of treatment strategies of what to do, and in so doing, we're going to get into acupuncture strategies, and we'll talk a little bit about some of the things that, some of the concepts that will go along with using primaries, sinews, divergence, low vessels, 8 extra vessels, and so forth. And with the mindset that we're going to get into divergence and sinews and low in a more in deeper context in another webinar, but we'll just go through some basics so there's a little bit of a context with which to understand how to approach rate and rhythm and heart issues from that perspective. We'll also delve a little bit into some herbal formulas and things of that nature. I know not everyone here is an herbalist, but I do want to touch on that because it's an important aspect. And we'll also go into essential oils, because there's a number of different oils that will be helpful for dealing with issues for the heart and rate and rhythm and different types of emotional issues like stress or fear or anxiety and nervousness, because oftentimes those are reflections of issues with the heart, as well as things that happen concurrently with rate and rhythm issues. Okay, so the first thing to understand when we're looking at issues of rhythm is that we are addressing issues that involve the entire pulse. You're not going to really find rhythm issues just in one position or another position. This is something that's a systemic problem, and as such, we're going to note that it's affecting the emperor, right? So the heart is the emperor, and anything that is within the empire will be impacted by rhythm issues. So whenever we're looking at a rhythm problem, we're looking at something that will relate also to the mind as well as the emotions, because of course that's regulated by the heart, but also the nervous system, which has a very close, intimate relationship to the heart as well. And so we know the heart controls the mind, and a lot of the stability of our emotional life comes from stability and strength and integrity in the heart itself. So when we're looking at problems that involve rhythm, we need to make sure that we're stabilizing the mind, stabilizing the spirit, and dealing with the heart as a unit. Rhythm is always reflecting the heart, no matter what. It doesn't mean that's the only thing that's affecting. So from a classical perspective, we would also need to really be thinking about the role of the lungs and see how the lungs are governing the movement of blood, but also, which is governed by the heart, but also looking at the relationship of the lung to Wei Qi, right? So Wei Qi is really the driving force behind the heartbeat as well as the rhythm, so rate and rhythm itself. So when we're looking at Wei Qi, we're looking at that which describes and governs smooth muscle contraction, right? So the heart is a smooth muscle, and so if we're looking at the proper movement and circulation of Wei Qi, then we're going to have a nice, healthy rate and rhythm. Anything that's going to interfere with Wei Qi, right? And one of the things that is common to happen, especially with like a febrile illness, right? We're looking at defensive Qi and its relationship of dealing with pathogens. That's one of the most common times that we can see an issue with a rapid rate, right? When someone gets fever or some type of infection. So that's a Wei Qi issue. That's part of that involvement. And of course, Wei Qi, we know, deals with the peristaltic activity in the gut as well, right? Another smooth muscle area. And we also want to think about the role of respiration and the evenness of our breathing mechanism in relationship to the heart and rhythm. You know, we know that if people are holding their breath, if people aren't breathing evenly, if there's shortness of breath, tightness in their chest, that can interfere with and have some type of impact on rate and rhythm issues too. So we always want to make sure that we're looking to diagnose the rate and rhythm, the role of the lung and Wei Qi at the same time. Okay. So when we're looking at rhythm and stability as a subset of that we have to understand that these are really some of the most critical diagnoses that we can have. And so it's kind of amazing to me that we don't really discuss it very much, because whenever we have a rate and rhythm issue, that becomes the most pressing factor in our treatment. All right, so in the very least, we're treating it concurrently with other issues that we're going to be looking at for treatment. Okay, so according to Dr. Hammer, the integrity of the rhythm is the single most important aspect of pulse diagnosis. Right, and we already discussed that the heart is the emperor, and so when we're looking at rate and rhythm issues, we need to understand that it is probably the most significant indicator of cardiac functioning and the state of health of the heart system. Okay. Okay, so when we want to figure out how to classify and characterize differences in rhythm, and so we're always going to look at it in terms of whether or not we're experiencing skipping of beats, right? But also whether or not we're slowing up and speeding up and slowing down. So these are a diagnosis that or a pulse quality that we call in the Shen-Hammer pulse system changing rate at rest. Okay, and we're not talking about normal heart rate variability, and that means that when the lungs are fully expanded, there tends to be a little bit of a speeding up when you breathe in and a little bit of slowing down when you fully expire. But that's really, those are very, very minimal, almost those are not things that are oftentimes very detectable in terms of the rhythm of the pulse, okay? And we're also not talking about something where if you count the rate and you get 60 beats per minute, and then you count again for another minute and you get 70, that's not necessarily a rhythm issue or a rate issue. There may be changes that happen depending on their activity, and it still may be diagnostic of other things, oftentimes some instability in the heart and in other capacities, but it's not really a rhythm issue per se. So when we're looking at the arrhythmias, we want to classify them amongst a few different parameters. One is whether or not the change occurs at rest, whether or not the rate is measurable, whether or not there are missed beats. If there are missed beats, whether or not they're consistent or inconsistent, how often the regularity or irregularity occurs, and if there's no missed beats, is there a changing rate, and if there is that happening occasionally, or is that happening something on a constant basis? And then, of course, we want to make sure that we're assessing the actual degree, how large or small is the shift, right? So is the cadence very, very dramatic, or is it speeding up and slowing down mildly? Okay. So according to Dr. Shen, all rate changes, right, and rhythm changes will affect and involve heart function, and they're intimately connected to the nervous system. All right. So when we're looking at the nervous system, we're going to have a whole class also associated with Dr. Shen's systems model, but we're looking at Wei Qi to some degree. We're also looking at Yuan Qi and Jing, right? So it's really a combination and a communication between the kidneys, right? Kidney yin Jing essence and its regulation over the central nervous system, but also how that's played out in terms of movement and circulation, and that's done usually by its counterpart in terms of the bladder and small intestine in terms of Tai-Yang energetics, right? Its responsibility and role over maintaining, at least from a sinew channel perspective, all the muscles and the innervations of the nerves. But we also want to think about that in terms of overall Wei Qi, and other systems from a Zong Fu perspective would be lung and liver, right? Since the lung deals with that movement and the liver is dealing with the actual circulation through the peripheral nerves as well as through the musculature, sinews, muscles, tendons, okay? And we know that when we undergo stress, that can impact liver stagnation, it impacts the spirit, the mind, the heart. It can impact and stress the adrenals, right? As well as the Tai-Yang in terms of the outward manifestation of the Shao-Yin relationship, okay? So that's very important to understand. Instability in the nervous system, right, in terms of that Jing essence, is going to create poor control over the brain itself and its relationship to the marrow, right? We know that when that happens, we tend to destabilize the heart, which winds up controlling, which is responsible for controlling the mind and the spirit and the emotions. And in turn, this creates this vicious cycle where it starts to create more imbalance in the nervous system, right? So we know that when you get stressed, it causes certain adrenaline releases, we get tight, we get armored, we get that fight or flight response, it makes us nervous, it makes us panicky. That panic and fear further feeds the anxiety and the tension that builds up, which causes a further release of adrenaline and further stimulates the heart and so forth. The heart rate increases, the rhythm sometimes can speed up and slow down quite dramatically. So all these things have a very intimate connection that we want to make sure that we are aware of, okay? So over time, the symptoms of emotional instability will increase both in frequency as well as severity. Okay, so all different changes in rate and rhythm are going to be implicated with chronic stress and any instability in the nervous system. So if someone's experiencing high stressful times of their lives, that, you know, this can be days, weeks, months, or even years for people, depending on their circumstance. So we can see how this creates a very significant problem in terms of innervating the heart as well as the nervous system, okay? I'm going to I need to just pause the recording for 1 second. Okay, so we're resuming our recording. I apologize for that. So someone was trying to just register for the course and was trying to get in right away. And so I kind of let them in and then the whole thing froze up. Okay, so moving on. So rhythm issues tend to have an etiology before the age of 20, okay? Now, this is not a hard and fast rule, so don't hold, you know, if you find someone with a rhythm issue and they swear that they had no trauma prior, you know, to that time, we don't have to get all worked up about it. But as a general rule, you know, before the age that the system is really fully maturing, and oftentimes before the age of 20, there's just more instability in the heart, the nervous system, and so forth, especially before puberty. You know, and so oftentimes you see a lot of rhythm issues involving traumas and problems that happen either in utero, birthing traumas, or things that happen early in one's life. Okay, so usually the more consistent the change, the earlier or greater was the triggering event. And, you know, when the event is usually worry, chronic worry, or even like an acute worry, usually that's kind of the least severe of the problems. Shock tends to cause the greatest change. And by shock, we're talking about heart shock or trauma, which we have an entire webinar that's going to be dedicated to that, and that one's coming up in February. So we'll spend the whole 2 hours on that topic. So constitutional heart qi deficiency tends to predispose someone to all different types of arrhythmias. Scarlet fever oftentimes can lead to rheumatic heart disease and create more significant changes. One of the case studies I have will show someone who had scarlet fever as a child, and the issue that we were treating was AFib. So with severe heart qi agitation, usually the rate's going to be rapid as well, especially when it's from shock. If there's a real true qi deficiency, the rate tends to be more rapid immediately after the shock and the initial stages, and then later it tends to slow down, except it tends to get exacerbated again when there's an acute stress, another acute trauma that the person's experiencing. All right, and so if the true qi is stable, right, if the root is secure, then the rate and rhythm tend to be a little more stable than otherwise would be. So the different types of arrhythmias that we classify them in terms of whether or not the rate is measurable and whether or not there's with or without missed beats. So the first one is called changing rate at rest, and this is a scenario where the pulse tends to speed up and slow down a little bit, right? And so it tends to be noticeable within a pretty relatively short period of time. So you have your fingers on their wrist, and it's kind of speeding up, it's slowing down, the cadence is kind of changing back and forth, but it's not dropping any beats, okay? And again, this is not to be confused with a variation in how many beats per minute. So if you take their rate and it's 60 beats per minute, and you take it later on and it's 70 beats per minute, that's not what we're talking about. You have to actually feel specifically that there's a speeding up and slowing down within that short period of time while your fingers are on the artery. Okay, so the interpretation for this is that this is a heart-chi agitation, and nervousness in the heart, creating some instability, and if it's occasional. If it's something that's consistent throughout the evaluation as well as over multiple examinations, we look at this more as a heart-chi deficiency sign. Okay, small changes, when the worry is less dramatic, when it's from worry rather than when it's from shock. When the constitution is strong, the left distal position can have this very tight quality in the center of the position, and if it's weak, it tends to be more of a feeble quality in the left distal position. Okay, and there's a few different sources of heart chi agitation. One is excess heat that comes from chi stagnation. Another one is yin deficiency heat, and the other one is mild shock or trauma. Okay, that can create that. Sometimes will create also a rapid rate at the same time. So large changes tend to be more of a severe heart chi deficiency, and then it can oftentimes progress into a heart blood deficiency, especially when there's more prolonged worry. Okay, and large changes are often seen in people with kind of borderline psychological states. So people who are really more mentally, emotionally unstable. Okay, oftentimes these things are happening from shock. Usually a moderate to large shock between the ages of 15 to 20. Sometimes, usually when it's earlier than that, the pulse can be even more dramatic. If there's a constitutional heart chi deficiency and someone is working beyond their means for a period of time, we can sometimes see these larger changes of rate at rest. Okay. Symptoms, emotionally, people tend to feel as if they're on a roller coaster ride, their mind racing out of control. They tend to feel pretty moody, right, up and down with their moods, very labile. They have a constant changing of one's mind. They find it hard to focus. They kind of doubt themselves. Their self-esteem and self-worth tend to be impacted. They're generally agitated and nervous people. They tend to get fatigued easily. They tend to have trouble sleeping, get palpitations, and they tend to wake up tired in the morning because they're not really getting a very good night's sleep because they're waking up frequently and they're just kind of lightly sleeping, not getting into that deep state of sleep. Okay, and all of these symptoms become more profound and more severe with larger changes in that speeding up and slowing down dynamic. Okay, people tend to show that anxiety. They get frightened easily, and overall their lives tend to be characterized by turmoil. They're just generally very chaotic in their lifestyles, and they tend to feel a certain degree of impotence in their lives, not really having the security and stability to make proper changes in their lives. And then, of course, what we see with this heart chi agitation and this racing is that they tend to have a red tongue, especially the tip, which we know, of course, is the heart area. And their eyes can have, under the internal layer, the mucosal lining of the eyelid, there tends to be a confluence of the blood vessels there. Okay. So when we start to see it get a little more pronounced and get into more moderate heart chi deficiency, all of these things can start to increase in severity. The palpitations start to come when they're exerting themselves. They tend to get shortness of breath on exertion, right? They might get spontaneous or excessive sweating, especially, and as that starts to really diminish the chi of the heart, that can turn into a cold sweat, right, as it goes towards yang deficiency. The fatigue, again, more pronounced in the morning, the insomnia we mentioned, and we can start to see more coldness in the extremities from improper circulation. Okay, they can tend to talk excessively because they're not able to really contain their emotions very well, and there's a little higher degree of emotional vulnerability and lability. Okay, sometimes we'll see a little bit of edema in the hands and face as well as the heart chi starts to get impacted and is not performing its circulatory functions very well. Okay, and so one of the things we see with the pulse is that we'll see this changing of intensity and amplitude. So normally what we want to see in terms of stability is that the amplitude of the wave reaches the same height, right? Because that's a sign of yang activity. But also we can see changing intensity, which is more of the actual substance of the vessel. And that deals a lot with blood and yin and so forth. And so we can start to see changes on intensity and amplitude. We can see them being more consistent. The rate can tend to slow down over time. There can be changes with exertion that increase less than 8 beats per minute. And we'll talk about that in a little bit because there's a whole rate issue of what we expect the heart to do when we swing the arm and try and induce a certain state of activity to see if the heart is properly responding to the activity that we're asking it to do. And so there's a certain range that we'd like to see, and we'll talk about that in a little bit. Occasionally we'll start to see even intermittent qualities and interrupted qualities where we start skipping beats, and we may see smooth vibrations over the whole pulse, and that's a sign of a tendency or this constant worrying on the mind. Okay. Sometimes we'll see a slippery quality in the mitral valve position or even in the left distal position. And when we see the left distal, it's a sign of phlegm misting the orifices and more clouded thinking and more confused thinking. And when we see it in the mitral valve position, it's usually a sign that there's some type of incompetence of the mitral valve with some type of regurgitation and mitral valve prolapsing. Okay, these are all signs of weakness and qi deficiency in the heart, and they also, from a Western correlation, that people with mitral valve prolapses tend to be predisposed to experiencing anxiety and panic. Okay, so the tongue can often at this point become pale. With the constitutional heart qi deficiency, we know there's that shallow midline crack that tends to reach the tip. It can get deeper as if it's kind of an acute issue as well, and we may see some paleness and swelling at the tip of the tongue, and the inner canthus of the eye tends to become pale, and even the entire complexion, especially the forehead, can show with some paleness as well. Okay, so you see how these rhythm issues that are cluing us into some of these bigger, broader perspectives in terms of diagnosis. Already we can see that as just from feeling the rhythm of the pulse, we can get a sense of some much larger systemic issues that are affecting our patients. And what you will see, unfortunately, is that you're going to find this in a very large percentage of your patients, okay, because it's really kind of epidemic, okay. And then in terms of etiology behind heart qi deficiency, we know it's, constitution and congenital factors are a major one, but overexercise and physical overwork is another. And when we get into the topic on rate, we're going to talk a little bit about normal rates per ages and depending on activity levels, but we don't like to see people with heart rates in the low 60s and 50s and 40s, even if they're marathon runners, sometimes especially if they're marathon runners, because it's this phenomenon where people are running themselves towards significant heart qi deficiency, and we'll talk about that in a couple of minutes. But physical and emotional trauma can cause, usually it causes an increase in the rate, but over time that increased rate winds up depleting the qi of the heart. And also, if there's some type of physical trauma, the stagnation that creates makes a certain burden on the heart itself, so that it needs to work harder to start pumping and clearing through the stagnation, and so that can tax the heart over time too. Dampness and heat in the blood, again, make the blood thicker and more viscous and make it a little more difficult to push. Rheumatic fever, heart qi agitation, all things that we're talking about start to become predisposing factors for creating heart qi deficiency. And as that happens, we start to see an increase in rate and rhythm issues. Okay, so it becomes this vicious cycle that it's so important to intervene at this level. Okay, so, and very important to understand that as the heart becomes deficient, it becomes more and more vulnerable to all other heart pathologies, right? So heat, phlegm misting the orifices, all these different types of things are going to become more prominent as that happens. And when there's a constitutional issue, it's just going to happen that much sooner and in greater measure, typically. Okay? So when the rate is measurable with missed beats, we have two qualities called interrupted and intermittent quality. So the interrupted quality is one that misses beats on an irregular nature. So every 3 beats, then 5 beats, then 7. It's not like it every 6 beats, every 6 it's missing all the time. So this is a moderate to severe heart qi deficiency. And if it's occasional, it can also reflect qi agitation with a more milder nature of qi deficiency. The intermittent pulse is missing those beats on a regular schedule, okay? And that's a little more of a qi, blood, and yang deficiency. And oftentimes the symptoms that go along with that, people will tend to complain of oppressive chest pain. They can be much more fatigued and have shortness of breath when they're exerting themselves. They may even have a hard time lying down. Their body tends to be cold, especially the limbs, and they often tend towards some edema, okay? And so if it's something that happens only occasionally, of course, it's not quite as severe. And we see that happening with some heart qi agitation, with some blood deficiency at the same time. And typically, heart shock or some type of trauma is the predisposing event. Okay. When we start to get to the scenario where the rate is no longer measurable, we start to increase the severity. It just kind of comes up a notch in terms of how significant it is. Right? So when it's missing the beat and it has no cadence whatsoever, and it's very hard to assess the rate, so you're counting and you can't even count because the pulse is bounding away and skipping around so much that it becomes so chaotic that it becomes hard to keep track of. Typically this is one of the more severe heart qi and yang deficiency scenarios, and usually at this point there's also pretty prominent heart blood stagnation and phlegm misting the orifices. When the pulse becomes hollow at the same time, meaning that the middle depth is no longer there, and we're looking at really the most severe heart qi and yang deficiency. This becomes a very significant situation that requires immediate interventions.